This episode is brought to you by Leela Quantum Tech.
Today, I had the privilege of talking with Dr. Chris Motley, who is certified in applied kinesiology, clinical kinesiology, acupuncture, and craniosacral therapies, as well as specializing in nutrition and lab analysis. Dr. Motley is also the host of the Ancient Health podcast, which I've also had the privilege of being a guest on myself, where we continued some amazing conversation. In this episode, we discussed the symptoms of Lyme disease, Epstein-Barr, and mold. Dr. Motley was so generous, and he openly discussed how he works with his patients who are suffering from any one of these kinds of illnesses. So he was an amazing person to talk to, and really somebody that I feel like this whole episode was just really eye-opening for me. I got some clarification about Chinese medicine and Western medicine and how it fits into the same picture. Yeah, just the science of it, really, because I always thought about what about Chinese medicine is scientific or isn't. And I felt like this conversation was just really eye-opening, as I mentioned before, and I found it to be really helpful. So, I personally could think of family members and friends that I wanted to be sure to share this episode with. And I think there's so much to be taken away from this conversation, and I'm really excited for you to hear this one. Hey, Dr. Chris, welcome to Vegas. I hope it's going well for you. And I'm so excited to talk to you today. I mean, we really got to touch base this morning, I feel like, but I've been following your podcast for a while, ever since I got to be on with Courtney, the Ancient Health podcast, by the way. I want to give that shout out because it's so good.
Oh, thank you.
And
thank you.
I can't wait to talk to you about all the things that you know. I really, really want to get into Chinese medicine. I really want to touch on that.
The Chinese medicine world.
The Chinese medicine world. So tell me a little bit about Chinese medicine versus Western medicine. And if you can plug in how science kind of, backs up either one or doesn't.
I love the question, because when we look at Western medicine in this day and age, they'll say that Western medicine can be really based on symptomatology. Mm-hmm. So they'll say that if you had high blood pressure, they'll give you blood pressure medication. And in some ways, some people in the Chinese medicine world may disagree, but I would say that Chinese medicine has a lot of symptomatology as well. So when you say what's the comparison is, instead of like looking at blood pressure or hormones or urinalysis, Chinese medicine would look at features that you can see the symptoms like on the surface. So that means that Chinese medicine looks at the facial features, it looks like the hand features, it looks like the shape of your ears, it looks at the pattern of your hairline. Wow. And what the body does is it is a representation of what's going on internally, because in Chinese medicine there are meridians, which are these small little pathways. Think of them as highways that are running through your muscles. So people say, what are you talking about? Well, your nerves carry electrical signals, but there are electrical signals running through your muscles and your fascia. If you have a balanced electrical system, you'll have healthy representation within your skin and your nails and your face. When you don't, you'll start to see certain areas of your body that may have eczema or rashes, and you may have seriously bleeding gums. You could have wrinkle in your earlobes, and people say that's just happenstance. No, it's not. When you're scientifically, like when you're developing as an embryo, we can go more to this, your body is following electrical patterns to grow and to give you your form. So as you're a little bean, as an embryo, and you unfold, literally with your hand, your nose, your ears, your body's following a pattern of electrical polarity, like a battery, north and south pole, and your cells will fold over each other, just fold over. Now the pattern that your nose would follow to give you your shape is determined, not determined, but it's given by your genetics. So when we say scientific, I will say when we talk about electricity in the body, we know that the patterns in our bodies give us representation of how well our organs are doing internally. Now, this would coincide with Western medicine in the fact that if you said to me, I had a spleen problem, I had mono when I was a kid, and you think that it is far gone, I got antibiotics, the mono is gone. But if I looked at you and I looked at the temples around and you had swelling and had breakouts around that area, or you always had chapped lips, or you got hangry every time you got hungry. Furthermore, if you always had problems doing tricep pulls, anytime you have that kind of symptomatology, first thing I tell you is that's a spleen meridian issue. And then I would say, okay, well, they're like, well, no, I don't have strep. I would beg to differ. I would take you to go get labs and see which forms of strep are still in your body. So I hope that didn't go down too far the rabbit trail.
No, I think I'm picking up what you're putting down, and I hope that the listeners are following this well too. But I think what you're kind of saying is that there is a communication that happens externally that is oftentimes a symptom symptom of what is going on internally.
Perfect.
And I love that because the more that I've gone into functional medicine and tried to learn about these things, of course, not a doctor myself, but I want the best for my kids. And I also want the best for myself as a professional athlete.
What would more vitality and peace of mind mean for your life? Is that something that you would like to have? Because I feel like we could all use a little more peace and vitality. And for me, something that has helped me balance my energy and keep that all in check is my amazing Lila Quantum products. Now, one of my favorite things is the Lila Quantum necklace. Not only is it fun and sexy and it's gender neutral, I love to wear it. It's really eye-catching. People ask me a lot what it is. And of course, I gladly oblige explaining because it is so nice to have something that is wearable that is going to help my energy be balanced. But I also love my Lila Quantum block, which I have at home. And I love knowing that helps neutralize the EMFs that are around us in our household with the Wi-Fi and our cell phones and all the gadgets. So if this is something that seems interesting to you, then please visit LilaQ.com. That's LeelaQ.com, and you can use code Miesha, Miesha, for 10% off at checkout.
So I look at these things and say, oh, the body's trying to tell me something. My body doesn't have words like I do, so it has this different ways of expressing itself.
Yes.
So I used to have eczema.
Where at?
I had eczema on the inside of, I believe it was inside of my left wrist and the top side of my right hand.
Okay, yeah. Like if you show me like the top side of your right hand, around
kinda
that
down
area.
my knuckle, yeah. Like
if
by
you
my
see on the
knuckles.
camera, usually on the knuckles, there's two things that could happen. It could be like you had large intestine, because that's right around your large intestine area. But the knuckles around in Chinese medicine and even hand reflexology would be that it's infections that's been happening around the ears or in the sinus glands. So I would check certain things. I would check your colon. Did you have any constipation or any type of issues with your digestion?
To my recollection, I didn't. What about stress, though? Would stress be a part of that? And as far as cueing these things that might be genetically like a predisposition for how your body deals with something?
Oh, yeah.
Right?
Yeah.
So we must have something in our emotional state when our emotions can trigger our hormones, right? And then our hormones get into this cascade where maybe we stay chasing this cortisol, which, we obviously don't want to live in a high cortisol state. But I kind of think that I was living in a state where I was under a lot of duress and I was very stressed all the time and really no escape of that. No escape of it in my home life and no escape of it in my athletic performance. Like so much pressure and stress.
Like with that though, with the wrist, when you on the inside of the wrist, that would show like they say pericardium stress, which would mean heart stress, as in not like physical, but emotionally. I'm just asking, was it like working hard and pushing yourself so much to get a result, but the joy may have been lost in the journey, like the vision of it, like you're working towards a goal?
I couldn't have said it better.
Is that would make me
hit the nail on the
think
head.
about on your wrist, like first things first.
The journey started to become so painful and everything, and it was my personal life as well. So when you're in a relationship that doesn't support, you coming down from that stress, then you kind of live in it 24/7. And so I think that was a big thing because it hasn't surfaced again since exiting that relationship. And I actually retired from the sport for about 4.5 years.
Really?
So I had to sort of reinvent myself, although it was just the beginnings of that. And I still feel like there's so much to learn. But that's so interesting.
It is like for you when you exit and you say like that never came back, it's like it's really interesting to me that they say that when like you created the scenario, I say of traumatic events like with your work, with what you did. And so those areas of your brain that you had to, strengthen to do your job and do your work, they start to record traumas associated with it. And they say that you start to, if you trigger that trauma, like it'll light up that area of the brain. But those areas of the brain are related to certain areas of the body.
Right.
Why do they go to the wrist? Some things I understand and some things I don't, though.
Yeah. I don't know either. Maybe it's just like, look at it. Your body's like, there it is. You can't not see it. It's on your wrists and your hands.
Yes.
Pay attention to me. Maybe it's the body screaming,
Well, like the great book, like they'll say Motion Code, Body Keeps a Score.
Love that book.
Those are
Body
great
Keeps
books.
a Score. I've never read Motion.
Emotion Code's good.
Emotion Code.
Have you read the book Feelings Buried Alive Never Die?
No.
I'm going to get it for you, okay? But they would relate, like, with your wrists. This is what they say, that your wrists, like, if you're doing your movements, I'm not saying I know anything about UFC fighting, but your wrists are basically there to help you pick up things and to pull them closer to you or push them away. So you have to look at the action of the joint. and you have to feel like emotionally, literally, like the action of the joint is to, it could be holding something up, picking something up, and your body's like, I'm tired of picking something up. I don't want to do this anymore in that aspect. So they say your brain, the action of the joint will also be correlated to the emotion you're feeling. And it happens all the time. People are like, why does somebody get a tear in their knee? Like, oh, this person had a tear in their meniscus, or they always have a hip problem. But they go, what, doc, why does it hit me right here? Those are the questions that I love to answer about emotions. There's a ton of emotions in those joints, you know?
So my son also had really, really bad eczema when he was a newborn. And he was always a hot little baby. He was kind of like lobster pink all the time, and he was just irritable. And luckily he was my second child, so I just thought, well, this is definitely not how it was the first time. He's a bit colicky. He's having trouble sleeping. He seems uncomfortable. You know, the stool was unsteady, and I was like, something's not right. And so my mom tuition kind of kicked in and said, okay, I'm going to just look at what I can find. And I talked with Johnny, and he was like, I used to have that when I was a baby. Until I was about a year old, I was actually hospitalized. I had such bad eczema, and they couldn't figure out what it was. And so I started looking, and I said, well, I'm going to start with diet. So I was strictly breastfeeding, and I eliminated everything from my diet that I thought could possibly be an allergen.
Yeah.
So and I was living in Singapore at the time. I thought I was going to starve to death because I was like, they didn't have as many options as they do here. I was like, I did it cold turkey. I had no time to prepare for this. I was just like, my baby's suffering. I can't eat anything. But I took out, shellfish, seafood, nuts, eggs, dairy, gluten. I think that was it. But that felt like everything to me.
It's
at
like
first.
everything,
yeah,
basically.
When you don't have a lot of other options. So it ended up being dairy. So I ended up putting one thing back in at a time. The first thing I tried was gluten because I love bread and carbs, and
delicious.
I'm better about it now. I'm a little bit more animal based, but anyways, I ended up finding out that it was milk, and I never had my baby formally tested, but I'll tell you what, I knew it was milk because the moment that I reintroduced that, and I did it like 2 weeks, everything I would reintroduce in 2 weeks, right? So I did everything off, then I did 2 weeks, and I put gluten back in, fine, put seafood back in, fine. Dairy was one of the latter ones, and in the moment I did that, body communicated right away. His stool was runny, his body went into eczema, patches all over, bumps, rashes, redness. And so I took the dairy out, and I was dairy free for almost a year, and that's what it took. So it was a milk protein allergy, which is you probably know that, right?
Yeah.
So it's like the immature, for those that don't know, some babies just have a little bit more of an immature digestive system, and the size of the protein of dairy milk
Can't
basically
be broken down.
Can't really be broken down. So anyways, that's just another example where I know what you're saying is true.
Yeah.
I know what you're saying is there was a stressor in the stomach, and so I think it's stressful physically, but also for the baby emotionally, and mentally, for them to have that pain that is also stressful, right?
It truly, I think it's when you say like the moment the baby couldn't basically take the protein. Like there's a gene called an LCT gene, and it's really crazy how they can isolate a gene that says you may genetically not have the capacity to actually break down lactose. And now they're saying that you can get a gene report and it says that. But one of the things emotionally that gets me is that you said Johnny, is that
that's my fiance.
Yes. Okay, so if he had the same thing,
I know
he genetically probably passed it, but
yes, and I feel so bad because I know that he suffered and he was drinking formula, and they just didn't know.
They didn't know.
So it just became a really big problem for him.
And I think even the stress response is like when your baby drinks the milk and such, is that there's probably really amazing is that there's a single section of the DNA that he passed on to the child. For some reason, when that dairy got into him, his body went into an emotional trauma or shock that says this is a protein that I can't handle. The baby should be able to drink that, even at a young age, and you think, why did it create such a histamine response or mast cell response? And I love the way you put it when you say like something in the gut, because like looking at the pattern of the eczema, like you say, well, he had it all over the body. We could go into the whole just like what it means, but you would look at the organ imbalance by finding out the pattern of the eczema on him, and that would tell me which emotion. So then I could look at Johnny and go, hey, I think I have an idea which emotions are affecting you. But truly, when you do drink dairy and you see that the little one can't handle it, one thing I would say is that emotionally, even at a young age, your child, you probably can find out a lot about your child, because if the stomach is weak and it can't tear down the actual dairy, it could mean emotionally that there's a program running in the family line that I've had to ingest quite a bit in my life, and I've had to take a lot in, and I've had to put up with it. But I don't want to digest this anymore. It's hard for me to stomach it. Now, if somebody doesn't consciously consciously think that as it comes
course.
in. But little ones, the program could be running because it does come from the parents. So genetically, generationally, you can pass energy down. And so, like I would say to Johnny, is like, was there something in your life where you felt like it was hard for me to process things and I couldn't digest it? I was tired. I was feeling nauseous in life, and I was having to throw things back up emotionally. Like I can't do this. That emotional program probably passed to your, your child, and so that could be a case. I'm not trying to overspeak.
No, I think it's very interesting what you just said, because I think, we have a saying in athletics that there's muscle memory, but I think there's also cellular memory. And think about how a newborn baby is born and knows what they're looking for right away. They're looking for mama's breast.
Yes.
How does a baby know that, right? Because there's something that was built into the memories of the cells that created that baby.
Oh, perfect. Oh, that is
right.
I mean,
that's the most core human instinct. So I think that's a primal example of like a baby who's never seen the outside world, never seen the light of day. Automatically, the network in the brain is already built in based on what's coming down, what it was given, what it was received from the parents, and that memory, right? So it makes sense that this could have layers of depth that just need a little bit more thought and understanding to, you know, you know who Dr. Gabor Mate is?
Yes, I love.
No,
have
I'm
you
a
had him
big
on
fan.
the podcast?
I have not, but
You
that would be
gotta
a
do
dream
it.
come true.
Oh, yeah,
he's
yeah,
amazing. I'm
yeah.
such a big fan, and so when I read the book When the Body Says No, I've read 3 of his books actually, but that also talks about the emotional traumas and how the trauma they have proven is received by the fetus if the mother is going through something traumatic, that the fetus will feel that, the stress of that. So what you're saying logically makes a lot of sense, and I think it's just something that's maybe too overlooked, and I wish maybe we would connect with self a little bit more and just think about the depth and complexity of our emotions and everything that goes into creating who we are.
Yes.
And where that came from, the origin of all of that.
You couldn't have put it any better. Like, I mean, it was so good because, like, when you talk about like when the child is in the womb and you could be experiencing an emotion, and in the Chinese medicine world, they call them energetic blueprints. And so when your cells are developing in the embryo, they're like fresh cells, and they have a vibratory pattern. They're just vibrating at a certain rate. And I have seen it personally, truly, in the office where, like, if a mother went through an emotional event, when the child feels it, they'll say, well, the child kicked, or I felt movement. It's why it's like, because you literally didn't mean to, but you experienced some kind of vibration that went to the cells. And then the cells regard any information like that, and then they will respond by either creating toxins or happy chemicals. And you see that, I've seen patients, have you seen children that come in and they go, man, ever since she was really young, she has always tried to protect me. The mother would say something like that. No, she doesn't want me to hurt. 3 years old. No, mommy. No, you're okay. And then I'd go back and ask the parent, well, we go through and do some checking. The mother went through a traumatic event where she felt super unsafe and almost got injured. And I guarantee you that child picked up on that vibration. Imprinted with that energy, and says, it is my responsibility, or I have to keep my mother safe. And it's amazing.
And that's also a survival instinct too, because children need their parents, So even if you look at it, from a selfish standpoint of that child, that I need to make sure that this person who keeps me safe and alive is also safe and alive, right?
That's so good, because when you want to keep people safe, I think that they will say that if the need to take care of somebody, it kind of nurtures the cell patterns of the baby. And like in the Chinese medicine world, they say like that baby could actually become more of an earth element, where people like to put their roots into this person. They become the person everybody feels safe in. They were going to protect you. And they've always been like that. They become the very warm person. So whatever's happening, energetic blueprints can cause the vibrations in the cells, they say, to actually shift, and they'll create different patterns within the child. And so that child has his own purpose after a while. And there's a great book that I really love. I should have brought it here in the room, but it's called, it's Invisible, not but Invisible Rainbow. And they talk about scientific studies about vibrational patterns and how you and I would think, like you just said, instead like we just mold over something and the baby's in the womb. And the more we think about it, like you say, the more you think about it, the more you attract it, but the vibrational energy actually increases. And they've done plenty of studies on it. And to me though, I don't want to get too complicated. What I love is to see that you could see how a person person, when they're emotionally in some trauma or if they're happy, the child will absorb it, but it changes the function of their organs. And so you start to see children that have different problems and different issues. And then the parent will say something like, oh, I had that exact same thing when I was 6 years old. Yeah, I know you've seen it too.
Yeah.
I've seen kids come in and I am so amazed. They'll come in and like, oh, I had this when I was this age. He had just like me. How did that body know to do that at the same age?
Right.
It's crazy. Like, and I'm serious. I'm not like a know-it-all in Chinese medicine, but sometimes I'll look at it and be like, it had a program that in the DNA and the energy was passed on. And then when you see it in your children, I was going to ask you, when you see it in your child, do you see stuff like that? Like, you see some patterns, you're like, that's exactly like me.
Absolutely. Yeah. And it's one of the most fascinating things to really sit back and realize that it's so complex. But I think a good note for this is like pregnant women should be celebrated.
I would say, to me, one of the hardest things, and I was talking to Courtney about this, is that pregnant women should be celebrated. And one of the things that's missing in our culture today, and I hope I'm not going down a rabbit trail, but I'm saying is like postpartum health. Like in Chinese medicine, we talk about prepartum health. There's something missing in the culture that there should be health for the mother after, even almost more. And when you say like celebration, it's like, if we're going down this path, but I'd say like with a child, when the child is developed and the child is, birthed, the mother is put so much energy emotionally through cells, through fluids, and the child's like thankful, and then the mother feels so depleted and so down, and you're like, what can we do to actually help bring vitality? And you know that you probably have had it maybe yourself or seen people that have had babies, and they'll say, oh, I had UTIs and I had kidney issues, because the chi and the kidneys are there to like help push the baby out, and then it gets so depleted. And then there's a culture where we'll we'll take some prenatals till we get the baby birth, and we're not doing anymore.
Yeah.
No, you need to celebrate and do more afterwards. But the problem is the mother's so tired that they don't have the energy to do it, and they don't feel nurtured and cared for themselves. I wish there was clinics all around the world that was postpartum.
Yeah.
I wish they did that. Anyway, I'm sorry I went down that trail.
No, that's great. I mean, I was kind of leading you into it. Wasn't where I expected to go, but I mean, it's just I feel like a topic that should be, we're just so disconnected as a community. And I think that is one big goal for me here with this podcast, is to connect science and yourself, intuition, right? I want people to listen to themselves more. When your body has a symptom, please don't oversimplify it. Don't just say like, I'm just going to go to a doctor and get something that makes it go away, because I feel like all you're doing is cutting the line of communication with the body. The body is trying to tell you that there's something, whether it's a deficiency or whether it's a toxicity load or whether it's stress or whatever it may be. Yeah. There's something that needs to be unpacked there. And if you just close the door on it, you didn't fix the problem, and it's probably just manifesting into something bigger that you're going to have a cascade of effects then later, which might even be more difficult to then figure out what the original problem ever even was.
One of the things I think that when you practice communication internally with your emotions, even scientifically, they would say that when you lose connection, like let's say to the heart, have you seen heart math?
No.
Miesha, you got to look at heartmath.org.
Okay.
And it's been around. I've studied it for years, and it talks about how a person can communicate with the heart. And the heart has such a huge battery, so much energy that it pervades through the body, through the walls, and that your body has so much of a battery back in your chest that you can feel the vibrational patterns of other people in other rooms. And they've done scientific studies where they would test how you looking at an image in one room and how it changed or shocked your body, and then you'd leave the room, another person would come in and they would feel the same type of energy. They would ask, what do you feel? And they would say, I feel fear, I feel worry. They did so many experiments like that. But the biggest case they said was that, especially like mothers, is that the heart, if you don't communicate with the heart, you basically lose connection to all the other organs, because the heart is like the one that rules the day. So to me, it's talking to your heart. People think that's corny. I said, no, we lose ourselves. You have to be able to find out what feeds you life and joy. And I know I'm not trying to sound preachy, but
no, this is my favorite part about why I wanted to talk to you, is because I think that you blend the two worlds so well. I mean, you're very well educated. You understand that there's a place for science, and you're pulling information what you can there, but you're not losing sight of, I feel like, maybe the most important piece, which is our connectivity, our self, our being. What is our body trying to tell us, and what do the signs say about that? And let's not just silence communication, but let's problem solve.
I mean, truly, that when we want to problem solve, it's like, I think the one thing about like Ayurvedic medicine or Chinese medicine would say that the connectivity, as they call it, like the mind of the organ. So they have different names for the different minds of the organ, which means that if you look at solving the problem, if you and I experienced worry, I would look at my stomach. If I experienced fear or fear, I'd I'd go to my kidneys. If I was angry, I would look at to my liver. Now, the thing they say is that the mind of the organ, they call it the mind, was that its job is to be able basically metabolize and process the chemicals that help you with the event you're going through. So if you are experiencing anger, like those chemicals in your livers needs to kick in, and it's like you need to metabolize that. If we recognize it and we're connected to our liver, if we're connected and I recognize I'm angry, I'm going to say, liver, you have complete permission to take those chemicals and process them out, and we can, hate to say it, put it in our poop, we poop it out, we go out through our day. But when we lose connectivity and we want to shove it away and just push it down, you're basically saying, liver, I don't want to listen to what you have to say. And in the Chinese medicine world, they say, well, the mind's not connecting with you, and so those toxins build up in the liver, and then you start having liver issues, and then you start getting angrier. And then I look at the face and I go, well, okay, you've got a few lines on your face, a few lines on your hands, you've actually got redness in certain areas of your face, and I said, you got the deep thinking lines.
What do you see in my face?
I would say this though, I mean, seriously, you've been in combat for so long, I'm just thankful you don't have like too many battle scars. It's really great. But I would say that you have a lot of water influence on the body, because you have really great cheeks that go back, and they smooth this to them, which means that you're very flowing, that you internally are an internal processor, and that our eyes are, when they go and they're nice and they're oval shaped and they have a nice, like almost like a Persian type look to them. They say, what do they mean? It's like it's oval shaped. It means that you could see through people, but there's an innocence too. It's like you can see through people pretty well. And the other thing is, with the chin and with the cheeks, you would say, if I want to be an internal processor, you would need time alone, and you need plenty of time to have restitution. You don't get enough time for yourself. I guarantee you, when you're a water element, you need afternoon time, right? In fact, you'll get tired in the afternoon because the kidney time is on 3 to 5, and you're like, if I could just have a walk or time by myself, I'd feel good, because your element needs to recharge you, the kidneys, the water element, at that time. So I'm not going to get too far-fetched in this, but like even on the face, with your face is like you have some swelling around the left eye up here, and it could be from an old injury or so, but they usually would tell me that there's old gallbladder issues that's congested. Okay, but left side of the brain would mean mostly young, more male-dominated areas, which I'm saying not domination, but I'm saying male-oriented areas, like from the father. So the male line of your life could have more frustration or more resentment. Maybe not that it was totally there, because you actually have good smile lines. I wouldn't necessarily think that your parents had a bad influence on you, but I'd say the father could have had some frustration or resentment or anger.
I just feel like you just looked into my soul, the peephole in my life. This is so weird. Like, how do you know this stuff? You hit the nail on the head, I think, with everything. I don't even know what to say about that, but that was the trip.
You're like this. You're like, I hope you never come back.
Yeah, right.
Because I'm not gonna watch it.
That's too embarrassing.
Oh,
I was like, know me.
Oh, that's great. I'll talk to you guys later.
This is our first time really seeing each other face to face. So I mean, it's that's wild to me that you have that perception.
But I'd say this, like when you see it within people, and you see it in your children, you see it around people, like you naturally have an instinct. If somebody make the hair on your on your skin rise, and you go, I don't know about that person very well.
And I'm learning to listen to my intuition now. I would say it took me a while, because like you said, the innocence part of it is so true too. So I'm very open to giving. I love to help people. That's why I started this whole process, and everything that I'm doing here is because I just like to help people. It makes me feel good. I love it. But I've been walked on so many times and taken advantage of by, I would say, people who are on the other end of the spectrum when it comes to that. And so I've had to learn to say, it's just okay to say no. It's okay to set boundaries. It's okay to be like, hey, this person, just their energy, something about it. I just don't think I want to be a part of that. I don't know why. It's my intuition.
It is like, because usually what I would say is like when you have like that instinct to have like more of a water element. I'm not saying you're fully water element. There's other elements that will come up to the surface at times. But when you have that capacity, they say that the receptors in your skin really are like more attuned to things that you probably would have a problem with. So you probably could say, I know when people are angry around me, or I know when people are sad.
I feel like I sense all emotions pretty deeply.
All of them. Okay, so when I really love, that's good. So some people just single out certain ones, but you would.
I feel like I read of course, but maybe I'm biased. I'm willing to say that too. Like I look at myself and I feel like I feel emotions pretty well. Like if I walk into a room, or if I am sitting with someone and I'm like, are you upset? I just feel it. And anger and frustrations and these things can have it put me in a state of guilt almost right away.
Really?
Yeah, where I feel like did I do something, or is there something that I need to do or I need to fix in order to help this situation?
See, that makes total sense because you said I love to help people. I love to care for them.
I don't like to see people
So
hurt,
when you're a
upset.
caregiver, they would say 2 on Enneagram, but they'd also say you probably have a lot of earth element qualities, which means that you definitely are somebody who would look out for somebody else more than you look out for your own self. You would look out for them.
Well, that explains the 9-year toxic relationship.
And when you take it, I will just say that would explain a lot. Yes, and we can go to that.
But it made me stronger in the end, and I'm so grateful for it because now I've learned the balance of the beauty of what I have and what I have to offer and who I am, and also the strength in the boundary.
Yes.
I think that's really powerful, and it's something that I've really learned to hold on to because that doesn't make me a bad person. It doesn't mean I don't want to help people. It just means I have limitations. And hey, if you're not somebody who can respect what I'm about to tell you that my boundary is this, then maybe we shouldn't be friends anyways, So it's kind of one of those that it's just been really beautiful. And I just tell people really upfront, hey, if you weren't somebody that I thought was my friend, I wouldn't be taking the time to tell you the truth right now. But this is how I feel. This is what I'm going to do.
I love when you say it's the power of the boundary because if you feel guilt, they would say the Chinese medicine world would say you have to be careful of your stomach eating or taking in too much of other people's junk. We were talking about before, but really it gets so churned and it gets kind of nauseous emotionally to you. It's that when you said I feel guilty, one of the biggest emotions of the stomach is guilt because you got trained to do that for 9 years and now you're going, this is not my norm. And
even modeled by my mom, I think much
really?
Before that. My mom was a big giver, and so she's learning, and I'm happy to be helping her. We're growing together in that process.
Oh, really?
So
you guys got a good relationship?
We do have a good relationship. Yeah, my mom's here actually watching my kids as we speak. So yeah, she lives up in Washington normally, but I think this is so beautiful, and I don't want to transition too quickly, but I have so many questions for you.
Okay.
And
it's fine. It's great.
I want to talk to you about Lyme's and these symptoms. I would say people who have that, because I remember learning about Lyme's disease and how it supposedly got out of a lab in Connecticut and affected a lot of people. And I even have a cousin who I really feel like she has Lyme's. Just she's been bitten by ticks. She lived on the East Coast, and she's got a myriad of health problems.
Oh, heavens.
And struggles from depression, a lot of rashes. And I also was like, do you have Epstein? So anyways, I'm so curious about these viruses because so Lyme's is technically, it's a virus, correct? And
it can
be.
It can be.
Or it's
bacteria. Lyme
bacteria.
disease is composed of different infections. But when they say Lyme from Lyme, Connecticut, is from Borrelia. It's a bacteria that's shaped like a corkscrew, and it bores into your soft tissue, into your joints, into your brain, into your spinal cord, and then it gets into it, and then it poops, and it creates the toxicity. And then people have issues with paralysis. They'll have shakes. They'll have seizures. They'll have brain fog. They can't think. They'll lose their memory. And the reason they found it was that these young guys were out playing ice hockey, and these kids were they literally have arthritis, and they're 13, 14-year-old kids. And I said, what's the matter? Why do they have that? And they found that there was an isolated bacteria around that area that they found out these infections when they did autopsies on the joints. They found these spirochetes all around their joints, eating them up because the spirochetes go in. Hopefully I'm not going too far, guys, but the spirochetes will go into the joint. And the reason they love soft tissue is because it has sugar in it. It has proteins and sugars, and it goes into your brain and it goes into your joints, and it eats it because it's meal.
It eats your brain?
It can eat the sugars and eats proteins. Okay. So it's it'll go into the soft tissue. And so when they've done this, there's certain autopsies, certain studies that show that they found that people that had dementia, on some studies, they said out of 100 people, I think it was 84%, all of them had certain amounts of spirochetes, the Borrelia, in the area, and it was actually in the sinuses eating away at the brain. Now, you could have the spirochetes Borrelia, but there's other ones like Bartonella. Bartonella causes cat scratch fever, and it's in the nails and the teeth of animals.
So Lyme's, there's more than one. Oh my gosh, how many?
Bartonella, Babesia, Ehrlichia, Rickettsia for Rocky Mountain spotted fever. Epstein-Barr virus has been tagged into it. I'm not trying to get too wordy. You guys write this down if you want, but mycoplasma, which is walking pneumonia, and they even say tularemia, which is rabbit fever. There's probably about 7 or 8.
But is Epstein-Barr is a virus?
Virus. Epstein-Barr is a virus.
And this is where I get a little lost in the difference between a bacteria and a virus. Now, a bacteria can be more easily eradicated or no?
They say it can be because really, bacteria are bigger than viruses, they they say.
Okay.
And so bacteria literally have different types of protein coats, like a big covering. And so they take the antibiotic and they find the ones that actually tear the protein coat off. But also, viruses are tougher. I can go into this, but you like the scientific part.
I
but,
do,
But the
yeah.
viruses can get into your cells. Some bacteria can, but viruses get into your cells, and sometimes they place themselves in your DNA strands, and your body will spend its energy making their parts. And Epstein-Barr, you will be making their parts in your cell, and they will put the parts in your cell. And when you are weak, they'll reassemble them, and then they'll pop your cell open because they replicate, and then they go and infect other cells. So that's how viruses work. They're called like RNA viruses because they're single strand. They can get into your DNA, and then they can jump into the order. They can jump right into your DNA, and your body will go, oh, here's an order for such and such part, and you make it, and it's like, well, what do we do with this part? And you're like, well, we'll just stick it on the side here, and then parts know, and you start to get tired of those little parts start shaking, and they put themselves together, and then they pop open your cells, and they go to the next cell. And I know it sounds scary, I'm just saying, but now the beauty of the body is this, and this is the problem with Lyme disease, is if you had Epstein-Barr virus, they're finding that your body with mitochondria is a powerhouse, creates ATP. There's a lot of mechanisms. I'll just go through one of them.
My sister has been diagnosed with Epstein-Barr.
It is so harsh because my mom has high amounts of
And
Epstein-Barr
she's
virus.
so young. She's like 15 years younger than me, and her health is not great.
I need to get you in touch with a really, really smart pharmaceutical doctor who does a pharmacy doctor. That would help especially with viruses, because they just say that people will throw everything at the virus, like all the B vitamins and such, but it will hurt your mitochondria from actually methylating properly. It will actually hurt your mitochondria from absorbing certain types of vitamin D. But your body is so innate and so intelligent that it'll say, hey, mitochondria, we cannot do this step, methylate, which is detox. We can't do this step right now because it will actually cause the viruses to thrive. Then we go in and like, oh, I'm going to take vitamins and minerals and iron and all this stuff. And sometimes, if you don't have the right physician or somebody working with you, you actually can weaken the body where those infections will thrive. And I hope I didn't scare anybody or put that out. It's just the science about it. The science. If you've seen Body Bio, they have a really good. Body Bio does like phosphatidylcholine. They do different.
What is Body Bio?
Body Bio is a company. Shout out. I'm just kidding.
Oh, yeah, right.
Sorry, that was ridiculous. But they have different types of like TUDCA, which is they use fatty acid and different types of fatty membrane components. Like that makes your cells. They use certain supplements to actually help strengthen your cells to help pull the toxins off of your mitochondria, to pull them out of your DNA. And so they're finding that individuals and the doctors that know how to use these proper types of nutrients to actually like clean the DNA, unfold them properly, push out the viruses, those individuals are then able to absorb more vitamin B and more vitamin D. Have you ever had, Miesha, where people say, man, I can't take vitamin B because when I do, I get the shakes and I get weird.
So my cousin that I told you about, that I'm suspicious she has something that, along these lines, because she gets full body rashes and she has the MTHFR gene.
Yes.
And so she struggles with vitamin B, and she just, also just struggles emotionally. I just feel like it's very complicated.
It is.
And I imagine that these situations just stress the body again. It's stressful.
It is. When you talk about Lyme, like when you talk about like rashes and unexplained rashes and migraines and headaches and vision problems.
Swelling, like water retention.
Completely.
I mean, her water retention is out of this world.
It is so bad because I don't want to go down story times or anything, but I've had like when you get parasites even related to it and they get into the joints and the joints are damaged and they get really retaining around the joint, is because there is a lot of infections that can get there and cause swelling in the area.
Yeah, because your body's swelling is trying to heal.
It
right?
is.
It's the body's
trying to cool it down and heal it.
Healing process. But it's when it's chronic, it's a problem.
It is. And it's so alarming now. And I say this like now that we're getting more research is that when you said MTHFR and then you start to try to kill the infection, but the MTHFR with that genetic variant, it is tough for a person now to actually absorb certain vitamins and minerals to actually detox the infection or to create a good immune system. And so you have a double whammy, and that's the horrible part of it. And they'll say that certain infections eat certain types of nutrients. They'll eat certain B vitamins, iron and stuff. So people go, well, I give up. I'm like, no, it's not a matter of giving up. Have hope. It's like you emotionally is the first step. You have to connect with your heart. And that sounds corny to some people, but it is not. You have to visualize and you have to create the scenario and the truth that you stop listening to your heart because your heart's so tired. But if you can create a balance, they show this in some research where you can count a balanced view of your heart, people's vision of their healing is so much greater. And they say those people have way higher amounts of healing. So it keeps you from wanting to give up sooner. But the first step, you're right, emotionally, is to connect with your heart. in those areas. Then go after cleaning up some infections and then do some MTHFR. That's my opinion, though.
Yeah. So I think what you're saying here is so important, and I hope that people are listening carefully, because I think the connecting with your heart it's simple, but it takes you to just agree to that. And I wanted to point out something about the placebo effect.
Yeah.
So, right, we know through science that the placebo effect can be a very, very real thing. Why is that? I think it's because people are being tricked into essentially believing something in a form, a shallow form of connection to heart in a way, maybe, right? That they're like, hey, I actually believe, I believe that I'm getting this medication. It's supposed to have this result. So therefore they believe it so that they do. Like their body can actually change without actually receiving the medication that they thought they were, just by simply believing it. So explain to me that.
It's
right.
The belief system. There is one of my friends. He has Ben Azadi. He's got a really great podcast. He said the story about placebo, where a long time ago they did this research where this doctor he was in the field and they were working with people who have experienced war, and basically the nurse had ran out of morphine and did not want to tell the doctor, so he gave the doctor saline solution, and the nurse told the doctor that it was actually morphine. So the doctor believed it, never said anything. He says, you're going to feel better in such and such time after we put it, give yourself about 30 seconds. He puts it in there. Every single person that he treated with saline solution literally felt better without any pain.
Medication, yeah. Or no morphine.
No morphine. And he said placebo effect. He's like, because his energy passed from his body into that solution and went right into
that person was open to receive that.
Open to receive.
Believed it.
And the belief system is really scientifically, they'll say well, what's placebo? This is what gets me. It's like, well, that's just placebo. I'm like, heavens, if I have a belief system, and you know this as well, because I know you've studied, I can tell, you have a belief system, what you're doing is causing your brain to create new neurons and nerves to actually make that belief a set program in your life. And then you're going to model your actions after that. And people see that with neuroplasticity and such. But placebo, this is what gets me. It's like people say, well, you can believe that all you want. It's like, no, if you believe it enough and practice it enough and put yourself in the position, you can actually see yourself get better with placebo effect. You can. And I know that, I hope I'm not getting too far off track.
No.
I think that when people say, well, I don't think they can help you heal, I'm like, no, they've done research, but I'd say I want everybody out there to literally try to picture their day. This is the kicker. If you have chronic sickness, and my heart goes out to you, if you've had that, can you get up in the morning and just picture yourself getting up and having a great smile and say, I'm going to have a cup of coffee and my toast and my eggs and such? And I guarantee most of them are going to go, no. It's like, because they're programmed not to do that. All I'm saying is placebo effect is, the science behind it is you have to grow nerves and neurons to actually carry the signal of your belief. That means you're going to have to carry a thought first that you don't even believe, and you want to keep carrying it till you do believe it. And I don't get it. It's like you training. It's like, oh, I don't know, I'm going to do some kind of maneuver on somebody the first time I do it. No, you're not. And that's placebo. And there's an opposite of the placebo effect, but I just want to say, this is good. I hope I didn't go too far down
Not
the
at
wrong trail,
all.
man.
There's no such thing here. We're just having a conversation, and I love it. So I think that's powerful. I think more people need to read into, what is the belief system, and you explaining it and what happens in, scientific terms, I think makes so much sense.
Oh, yeah.
There's power in believing.
It is.
Yeah.
And the belief systems, what do you feel like when you believe, are you a hard skeptic when you believe, or like anybody in your health, do you I'm just going to practice this and see if it does well, and then I start to believe it, or do you you go gung-ho into it?
I think that what I tend to do now is to say, you know what, I'm going to try this, and I'm just going to have an open mind about what this could or couldn't do, and then I just try to document unbiasedly as I can. I live in my own body, but hey, how do I feel about this today? Did something happen? Anything unique happen? It was 30 minutes after I took this supplement. Did I notice this at all? Okay, I'm going to take a note of that, even if it's a mental note. Or hey, how often am I forgetting my keys now versus how I used to or whatnot?
Yeah.
And I just kind of keep these little mental notes, and so I'm constantly checking in with myself. Myself and my feeling about something. How do I feel? But does it resonate with me? People say, well, how do you choose your guests? And how do you know? And how does I said, well, I'm talking to people that speak to me, but I want other people. Don't take my word for it.
Yeah.
I'm not a doctor. I can't do your work for you. I have my experiences that I'm going to share with you, and I'm going to bring to you people that I think because the way that they make me feel could help other people in their knowledge and how they also communicate and connect. I want people to listen to themselves. I don't want them to listen to, don't take my word for it, right? I want you to connect with yourself, and I want you to know that there's a path to do that.
Yes.
Right?
Yep.
I think we trust too much in the sick care system.
Oh.
Right? We put blind trust. We assume that because somebody paid a lot of money for a degree, that all of a sudden they're here way above us and we're down here like little peasants, and that we have no say in this. I don't know how many moms I've talked to that have gone to pediatricians and been so dismissed and frustrated. And of course, most my friends, women go to the doctor, men too. And, something's not right. Something's wrong. Oh, it's probably menopause. Oh, it's probably this. Oh, you're just stressed. Oh, it's just life is just hard. Here's this, here's that. Here's an antidepressant. Here's an antibiotic. Here's this, here's that. And it's I understand that I believe most doctors mean well.
Okay.
Right? I think that most doctors get into this field because they want to help people too. But the system's working against them just as hard. Right? When you have 15 minutes because you're on an insurance model and you don't get to ask about how someone's sleeping. You don't get to ask about how they're eating, much less are you educated on those things, because that would be too good, right? That would be too much of fixing the problem. It wouldn't be as lucrative. So I want to step outside of that and give people some hope that there might be something for you outside of this box that we've all kind of been taught to conform to.
That is, truly, like the conformity aspect of, I love the way you put listening to your body or communicating and knowing that something doesn't feel right or something's not right. And I would encourage people like err on the side, if you can use that term, like listening, because sometimes, people would go along with advice that probably was not the best for them, but they went against their instinct, and they
all the time.
And the issue is, like you just said, is like your body's trying to make a communication with that organ. That organ is literally shooting a signal to your brain going, hey, that's the mind, the Shen of the organ. It's like going, this is not going to be good for you or cause balance. And when we're in a system where it's, if a doctor comes in and says, hey, Miesha, how's your digestion? How are you pooping? How are you sleeping? What's your energy like in this there? Like, what do your nails look like? What does your skin feel like? Do your tongue feel coated? And then you're not going to go to the doctor and get those asked, But I would say that.
But I would think it would be so refreshing. I think about that, but like, God, that'd be really nice.
It'd be nice. Yeah, like when they say
that's why I don't go to see doctors, like unless I break something. I break a bone, okay, I'll go see the doctor. But if it's anything to do with my health and wellness, I'm seeking, conversations with people like you so that I can learn and educate and then myself. I think my body is my own best doctor. It's my own best form of communication.
Yes.
And you know what? The body's not biased towards anything either. I feel like the body will know what it wants to heal. Granted, it has the tools, resources, and willing participation of yourself to do what it wants to do.
That is a great way to put it. I mean, it's truly like learning to, when you listen, and even like using your symptomatology, like when you go to the doctor, like using that as a stepping stone. And so like when you learn how to listen and you don't let fear come into it. Like I tell people when they come in, they're like, Doc, this is, this, I'm like, okay, don't let fear get into the way of it. Use your symptomatology as your path to healing. I'm telling you, that's what you have to do. You got to listen to it. And one lady comes into mind when you talk about parents, and I'm saying she knew instinctively something was wrong. She is one of my close friends, she's an anesthesiologist, and young son had really bad eczema, okay, like really bad. And unfortunately, the physician that was talking to her said, hey, you just need to learn to have lotions, anti-itch creams in your closet for the rest of your life, and don't worry about it. And she's like always in tears. And then when she came, she's like, in my heart, in my spirit, I knew there had to be something else. And that's the mind of the organ. That's like, that divine intervention, that intuition.
Did you guys figure out what it was?
Yeah, you got the little guy. He had strep super bad. He had strep so bad in his tonsils and in his neck and parts of his head. He also had mycoplasma, which is like a bacteria that causes pneumonia. Now, he had that. I'm sorry if I'm going down a rabbit trail, but he had so much strep. And he had old viral proteins, and I can't talk about where those things came from, but it's like old viral proteins that were festering, in my opinion, in certain cells of the body. But when he got strep, and he may have gotten through breast milk, he could have gotten somebody else, then he exploded. and it went all over his body. And one of the main areas that always showed up on him was on his small intestine, meridian, on his back end, on his cheek, and it went systemic after a while. It was all through his lymph nodes. So long story short, we had to go very slowly, and I did use herbals, like low grade herbals. We started using that, and then we started doing a lot of cold laser with the frequencies of the infection and putting it on the areas where he was getting sick. So we had to be very careful because he would start oozing. Like he would start going, like this leg. And there were parts of his legs that took me 6 months. And it would flare up and go down. And every time he did it, he would have a flare-up of strep or mycoplasma. That's how deep it gets into the system, into the dermal layers. And with this, though, we started using homeopathics too, and reminding his body what it forgot to do. And the thing is, like whenever a kid or anybody gets an infection, we get the stuff on our throat, like strep. Like, okay, you have strep, you have eczema. But there's one thing I want to say. When you have it and we give you the homeopathic, it's like you just forgot what strep is because it's become part of you. And that's the problem. Like when we get so used to somebody or something in our life and it's not the best for us, we get so used and so tired of handling it. We're like, it's just there, and we have to keep on handling it. And we go, here's a homeopathic. Please we try to remind you to know what it is.
What is a homeopathic versus an herb versus like any other form of like herbals? Like
homeopathic is probably one of the most strong of them all. So really quickly, in a nutshell, it basically is the energetic quality, energetic sounds unusual, of a plant, of the flower. So you take the flower and they basically use the liquid from the flower and they keep breaking it down to smaller portions of that liquid. And basically you just get the essence of the energy of the flower.
Would that be a tincture? Is a tincture?
Tinctures, herbs. Tinctures where you take, you can have energetic quality to it, don't get me wrong, but you're actually using the actual physical components of the flower, whereas in a homeopathic, you're just using the straight, you are breaking down the quote tincture so much that all you have now is the energy of the flower. And so when they give you that energy, they will give you a flower. Let's say you said, I have a headache, Chris, and I'm like, okay, so I give you a homeopathic that gives you a headache. And you go, why would you give me a headache
on top of a
headache? Why would you do it? Like treats like. Why would I do that? Because you forgot what a headache was. And this is the cool part, I'm going to give you something that goes, Miesha, this is what a headache is. And so I want you to activate the parts of your body to know what it is. And then you go, oh, that's a part of my brain that...
So you're cueing it instead of ignoring it.
Exactly right. You're causing your body to go, what is this? Is it part of me that's naturally me, or is it not? And then your body goes, no or yes. And so when you give that to the person, they start to get in connection with themselves. And I'm saying it's some of the most powerful. I'm telling you, Miesha, I could go through story time, but when a person does that, then their emotions come out. They'll go, because when the kid had stress, all over his body, you know what's showing up? His lungs, right? Lungs in Chinese medicine have to do with skin and protection. Need to protect every part of my life. And what it means, it wasn't hard. He wasn't hurt. It was genetic. It was like some emotions that came down through the line about protecting and grieving about protection. And so what happens when you give him the homeopathic, the kid doesn't know what he's got. But the beauty of it is it pulls all those emotions up to the surface, those energetic imprints. And we started cleaning that, the eczema started to stay away. It didn't ever come back. Isn't that crazy?
I mean, it's wild. Oh my gosh!
I'm sorry so much, but it's like it's fun, isn't it?
No,
I know it's time. It's getting close. We got. It's
yeah.
Been
We'll
good.
wrap this up here, and I have one last quick question. But I just want to know: so you, in what you are doing, are able to help people connect and heal. I mean, you have you have pretty successful.
I will say, not pat myself on the back. I've been doing it for over 20 years, and I'm thankful. I've really full practice. We have a lot of. I'm in it, Miesha. I'm working on people almost every day. Like literally, they make a joke at the office. They're like, "Did you have your pillow in your blanket here and stay here last night?" And then I'm like,
how do people even get to work with someone like you? Because I think sometimes, even for me, it looks like I don't know how to find somebody like you. If I wasn't sitting down and be able to have a podcast and have a conversation with you, I don't know how I find someone like you.
I would say this, some people would say with muzzle testing or craniosacral therapy. But really what I would say is look for somebody who does I say Chinese medicine mixed with applied kinesiology or kinesiology. And that's a study of motion or movement. So I'm just saying if you can find a practitioner that does kinesiology, muscle movement, and knowing the mechanisms and the functions of the body and mix it with Chinese medicine, those two. So remember that, guys, kinesiology and acupuncture. If you can find osteopath, a chiropractor, a physical therapist that can practice those things and then knows a little bit about herbs, I think you could have a good combo. But I say if anybody that can get those combo and look into biofeedback frequency machines, and anybody in your area that does a biofeedback or a frequency treatment machine usually knows people that can do different things like we do. You don't have to be dependent on me. I don't want that either. I'm like, you guys just look into that. But online, look for kinesiology, and that's how people start to work. I mean, I just grew through just word of mouth. And then when I did some Instagram, some people come, but I've gotten so full. Like I've got to train other people at the office because I don't have enough time. Yeah, it's really crazy. But I'm thankful. I'm grateful.
Yes.
Truly.
So these things sometimes say that like they can't be healed. Like you could never get rid of Epstein-Barr. You could never get rid of AIDS or something like that too. You know, I mean, I don't know if that's not really necessarily in the same category. I mean,
it's like some people when they say Epstein-Barr, I mean, I know when people would say, because they say there could be hidden pockets of Epstein-Barr. I have seen patients and people have gone down to like near zero with their indicators. But again, like, you could have a pocket hidden in the spleen somewhere and it popped back up.
Right.
But I have seen people that have gone down to to nil, like and such. Yeah. So I'm not guaranteeing anything, but I've seen it. Yeah.
Okay. No, I think that's plenty of food for thought. You're incredible.
Oh man.
So thank you so much, and I can't wait to have another conversation with you because there's still a whole bunch I want to get to.
Dude, I'm so thankful. I want to tell everybody I'm super thankful, Miesha, you let me come because I just tell you the warm spirit and you're like, to me, it's like being able to come here. It's a privilege, and I want you to be on mine. We will, and I just can't wait to have more conversation with you.
Definitely.
Yeah.
All right. Thank you.
Okay.
The Built for Growth podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Our content may include sponsorship and affiliate links through which we earn a small commission on sales made through those links.